Hi, everyone. Thank you so much for joining us for today's HTRC Education Series session. My name is Haley Bell. I'm the Program Manager for the Heartland Telehealth Resource Center. Just a few notes before we get started with our speaker. The session is being recorded, and we will share it with you afterwards in that follow-up email, along with the slides and some other resources. Please use the chat throughout the session to ask any questions that you may have. We will have quite a bit of time there at the end to cover those. If you would like a certificate of attendance, you can email us at htrc@kumc.edu. We'll put that email in the chat, so just please be sure to include your full name as you'd like it to appear on the certificate. And then we can go ahead and get started. So I'd like to introduce our speaker, Erin Martin. Erin Martin's passion for helping others began at 15 when she worked in a retirement community, inspiring her to pursue her master's degree in gerontology from the University of Southern California, the world's top-ranked gerontology school. Certified in regenerative soil advocacy, Erin is passionate about promoting food as medicine and its connection to soil health. As president of the Tulsa Urban Ag Coalition, founder of Oklahoma's FreshRx program, and co-lead of Oklahoma's Food as Medicine Policy Coalition, she works to integrate food as medicine and regenerative agriculture as a standard of care for those with chronic disease. So thank you so much, Erin, for being here. We'll go ahead and pass it over to you.
Thank you all so much. I'm so excited to share about my biggest passion in the world and my work. It's great to have a job that doesn't feel like one. I just got back from Washington, D.C. I work on federal and state policy, but I started a program in 2021 in Tulsa, Oklahoma, for food as medicine. I wonder if you could put in the chat what you think food as medicine means, or if you've heard of it before, or if you've heard of other programs before. If you could say in the chat, that'd be great. Just interested in what you all might already know and what you're most excited about learning. I really connected this to the land, and I understood food as medicine and that food played a huge role in longevity from some of my work. But I really connected it to the health of the land and the health of the people are one and the same. They're inextricably linked. We've been very separated from the land in many ways. I think a lot of people and children think food comes from a package in a grocery store. And I think the value of food and its impact on health and longevity and aging and chronic disease has been very devalued, and it's really starting to come around and have quite a movement. There's a huge shift in what's happening in food as medicine worlds. It's been many food as medicine programs have been funded by grant funding, and there's a huge shift of getting healthcare to fully integrate these food as medicine interventions for chronic disease. And as many of us know, chronic disease is rampant. It's rampant in older adults and people and children. I heard a stat in Washington, D.C. that 50% of children are obese and 20-something% are pre-diabetic. In Oklahoma, we have a third of our population is pre-diabetic or diabetic, and we've seen this go up and up and up. And most of these chronic diseases that people have are actually reversible. Thanks for the try there, Gerard. Appreciate that. Nutrition is directly linked. It's linked and has the largest ripple effect in anything I've ever seen in healing for people. Emotional healing has a big ripple effect too. Some of it's very tied together, as I'll probably get into. But want to give you a little bit of background about my story. As Haley mentioned, I started working in a retirement community when I was 15 years old. I fell in love with older people. There was 135 residents, 55 and older. I was a food and beverage server, and then I was promoted to the front desk. I was emergency response to those 135 residents as a 17-year-old. Yeah, that's scary, right? From 4 p.m. till midnight. So if they had a fall, I brought IMSA in. I saw a lot of stuff as a very young person, but I also just loved and felt drawn to the authenticity and the wisdom of these older people. And I really wanted to learn from them, but that was really my first entrance into some of these breakdowns in healthcare and in long-term care. And everywhere I turned, there were more problems. And by the time I was in my mid 20s, I had worked in all levels of long-term care. I was working in HUD housing, senior housing, that for low-income seniors. I was running social services across 7 affordable housing sites and had a team of employees. We served about 700 low-income seniors. I was volunteering in hospice. At the same time, I was learning from a group called Justice and Aging in Los Angeles that are these wonderful lawyers that advocate for older adults. And I was learning, and my team was trained on how to navigate Medicare, Medicaid, Social Security, and all the complexities and the spider web of services, of health insurance, of housing, of breakdowns in these things, and what a mess it was. I saw patients and clients on 15 to 32 prescription drugs at a time, and I was learning in my gerontology program that disease is actually not a natural part of the aging process, but it's become so normalized, we assume that you just get a disease one day and you die. And I was very interested. I started learning nutrition and aging and really understanding that nutrients, you really should be getting nutrients from your food, but all these people are taking all these supplements. We read many studies about vitamins and supplements and how older adults are actually overdosing on some of these things, that really older adults shouldn't be on many of them, that maybe they should be on vitamin D, but that might be it. We learned a lot about polypharmacy. The average 65-year-old is on 15 or more prescription drugs, specifically in the United States. 70% of the world's prescription drugs are prescribed in the United States. I started learning about the blue zones of the world where people age the longest in the world, the largest concentration of centenarians. And I learned what these communities all over the world, there's about 6 of them, had in common. And they had many, many things in common. One was they had a close connection with community. They lived intergenerationally. They walked a lot, so lots more exercise. They ate a lot of local whole foods, locally grown, had more kind of plant-forward diet. I wouldn't say plant-based or vegan. They do eat meat, just maybe not 3 times a day. And these people die of something called old age on zero prescription drugs. And that very much helped me connect. I actually got to go to Italy and study this. And it started connecting the dots for me that food was a catalyst for so many things and for even connection. One of my favorite things about eating out is connecting with people over food, breaking bread, so to speak. And it's something we've really been separated from. And so I connected food as medicine at the time, had no idea that it would have anything to do with the way it was grown, which seems very ironic now. But this is me actually testifying before Congress last year under the Older Americans Act, advocating for food as medicine in county funding. And some of it got entered into legislation, and that was a really cool experience. And DC, I just keep going back and doing more and more, so it hasn't slowed down. But what I really didn't understand was the connection of humans and soil. And I know you all are more healthcare focused, but this is so critical to understand, even for your own self. So I'm going to give you kind of a tiny little biological scientific understanding, and then we'll get into the nuts and bolts of food as medicine programs, how it's being integrated into healthcare, how that ties into rural health and telehealth, things that you all may be very interested in. So I found out about this soil advocacy program through Kiss the Ground. And if you all are intrigued by this idea, they have 2 documentaries on Amazon Prime, one called Kiss the Ground, which is the nonprofit organization name. They also have a book called Kiss the Ground, and the newest version of their documentary is called Common Ground. Both are on Amazon Prime. There's some big celebrities like Jason Momoa and Woody Harrelson in these documentaries. Celebrities very passionate about saving the soil for so many reasons. They focused a lot on the first movie on climate, which it certainly affects. The way we farm affects our climate and our weather patterns. But particularly the second video, the second documentary, Common Ground, goes into more of how this affects humans. And I'll go into this. And I think that this is really what makes this so important, what hits home for most people. And you'll see what I mean in a moment. So, humans are affected by the environment, food, and chemicals. So is the soil. As above, so below. It's biblical for some people who understand it that way, but it's very true. It's all very much connected. And a lot of people think that, maybe plants just automatically have nutrients in them, but they actually have to the soil has nutrients in it, and it gets into the plant, which is how we get it and how the animals get it, and then we eat the animals or the plants. And what's happening is these microbes here, some science was developed in the 90s to talk about mycorrhizal fungi. There's these intricate webs of fungi under the soil and root systems that are sharing nutrients with each plant. Some plants take up nutrients, some give nutrients, and it's this very symbiotic, beautiful, created scenario. But what's happening is we've taken, instead of like a holistic biological approach, which used to be the case when Native Americans really managed or stewarded the lands, and we had bison everywhere moving things around. Animal integration is a big part of this. What happens is we've taken a chemical approach to really controlling and wanting to scale yield when we needed to feed the world. We've sacrificed a lot of quality for quantity. And when we spray 1 billion tons of pesticides and fertilizers onto the soil, we kill these microbes. And the microbes are the translators of if there's nutrients in the soil to the plant. And so we're kind of destroying this process. And so over time, we've seen nutrients deplete drastically in the food. So a lot of you may not like vegetables, and it's because there's not very many nutrients in them, and they don't taste very good. So just real briefly, this 10% on the left here, soil organic matter, this is where kind of all the nutrients and the carbon comes from. And that's the medicine, that's the nutrients and the decay and all the good stuff that makes soil soil, as opposed to dirt here on the right. Our soil is supposed to have about 10% soil organic matter, and most of it now has less than 1%. And that's not good. And this translates to a crazy depletion in vegetables. This study is over 30 years old. So just imagine that we've continued these same practices. And look how far copper declined 76% out of these 27 vegetables. Same with meat. These minerals are key to self-healing, to operations as a human being. I like the saying, they make up 5% of your mass, but dictate 95% of your functions. They allow us to absorb other types of nutrients, vitamins, phytonutrients. They all are key and work together. So vitamins, minerals have been horribly depleted in our food. And then on top of that, our food is traveling an average of 1,500 miles. Even the USDA will say fruits and vegetables in particular, because of the way they are, lose 10% of their nutrients every single day. And the average fruit or vegetable in a grocery store is 14 days old. So we've depleted our nutrients from the way we've grown food. And then we've shipped it. We prematurely pick it, artificially ripen it, spray a lot of chemicals on it. And it's 14 days old on average in a grocery store. So we have a problem here. We have a major issue, and we have skyrocketing chronic disease. Now, on top of our food supply, we've also got this other element, which I don't want to dismiss, is ultra processed foods, which will now have a definition for ultra processed foods. And you can think about that from, I like to simplify it by saying you have a whole apple. That's a whole food, not whole foods like the grocery store, but you've got a whole apple. When you cut up that apple into slices, that's one form of processing. You grind that apple up. That's processing it. You make applesauce. That's another process. You add in sugar and some other ingredients. That's processed food. And then you put lots of other stuff in it. You emulsify it. You change its form into something else, and that's ultra processed. So these are causing problems at the same time as our whole foods and things we should be eating are incredibly depleted. But when I learned about what is now being called, which is really ancient types of growing, which is holistic management or stewardship of the land, what I learned was, and what was really exciting is like, yes, we've horribly depleted our food. We're not getting what we need as humans. We're running on steam. I'm sure lots of you on the call will relate. You're tired, you have brain fog, you probably have some irritable bowel stuff. There's all sorts of issues that we're all facing, maybe not sleeping well, having anxiety, depression, all sorts of things. And we're learning more about the gut microbiome and the connection to mental health as well. And our guts are really all messed up with all sorts of stuff, especially if we're overprescribed pharmacy drugs. And what was really exciting and what gave me hope for the future was that regenerative ag, which is kind of beyond organic. And I can definitely get into more details, but I want to definitely spend a lot of time on food as medicine programs, is that we can not only increase and restore the nutrients that was in our food 50 to 100 years ago, but we could increase it with using just basically mimicking nature. We've gotten into very monocropping systems, and there's nowhere in nature that naturally exists. And there's a reason why that is. So you can see here with this comparison with cabbage, how much more nutrients is in from conventional growing, which would be, spraying lots of chemicals, doing lots of tillage, monocropping. Organics probably got a little better nutrients, sometimes not. They have to over-till the land, which disrupts a lot of those translations of nutrients because they're not using herbicides and pesticides. And then when you use all the organic and regenerative practices together, you can see some of this increase. They've actually seen up to 90 times more phytonutrients, and there's a lot of new research coming out about this. So there's not a ton of research. Another thing I like to point to is there's nutrient variation in the food supply. This study was done by Bionutrient Association. They looked at 21 crops, and they saw there were vast differences between this blueberry and this blueberry. What they found is the stuff that had the most nutrients in it was stuff that was local. So if you bought it locally, obviously it's not traveling 1,500 miles and losing nutrients every single day. It's fresher for much longer. But if it was local and it was grown regeneratively, it most likely had more nutrients in it. And so I think a lot of people just think, well, a blueberry is a blueberry, a grape's a grape, spinach is spinach. And I think it's very empowering and also probably a bit overwhelming that they're not the same. And your tongue knows. So when our participants of our Food as Medicine program eat these vegetables, and even my team and myself, we have never had real vegetables before, and it's very obvious. Your brain is an amazing computer, and it needs nutrients. And when it gets the nutrients it needs, it has something, it's satiated. Your brain turns off and says, I'm not hungry anymore. Well, we're eating these very high caloric meals with very little micronutrients in them. And so we're overeating, and it actually becomes more expensive. Even though maybe you feel like maybe the local food is more expensive, you have to eat less of it to be full. We're very much overeating. And so here comes FreshRx Oklahoma. So I moved back to Tulsa in 2019. I grew up in Bixby, Oklahoma, just south of Tulsa, and I felt very called to come back to Tulsa. There was a longevity difference between North and South Tulsa that was pretty drastic. North Tulsa has the highest mortality rates of diabetes in the county. Didn't have a grocery store for 14 years. Lots of poverty. And a doctor came forward. I think I've got a picture of him here. Here's Dr. Kent Farish. And he said, Erin, my patients are compliant with their doctor's office visits. They're compliant with they're taking their prescription drugs. They're doing everything they're told. And they're getting worse. And they're type 2 diabetics. They were in very uncontrolled A1C ranges. They were high up into the 10s, 12s, 14s, which means you are at a very high risk of having a stroke, heart failure, death, amputation, you name it. And he said, we've got to do something, and I want to prescribe food. And he asked, can I help you do that? Can you help me do that? And I said, absolutely. I had some free time. It was the pandemic. I call FreshRx my pandemic baby, COVID baby. Certainly, food supply shortages and other cracks in our society was very much highlighted during that time. I volunteered a lot in the community giving out food, and I thought we could be giving out better food to help people who already have horrible chronic conditions. And so I said, I want to source all local food and regeneratively grown food. And people said, Erin, you're not going to be able to do that, not at scale, not year round. Uh, and I'm really proud to say that we have. And I'll get more into the work with the farmers. But so I've fundraised for 4 months over Zoom during the pandemic, and we raised enough money for 52 patients to launch in July of 2021. We took from really great models all over the country, one in particular called the Geisinger Food Pharmacy Study that showed if you gave people some food and some education with type 2 diabetes, you could reduce their A1C 1 to 2 points in a year. And that doesn't sound like a lot, but that is the difference between often life and death for people. And that's actually equates to $16,000 to $24,000 in healthcare cost savings per person per year. And our program costs about a fifth of that to do this and causes long-term change. So we designed this program. We've grown. We now receive referrals from 22 primary care clinics in Tulsa across 6 health systems. And you can see my beautiful team here. A lot of folks that one of which is a graduate of the program who now is enroll people. 2 of our team members had individually lost 100 pounds. One has reversed her diabetes, grows her own food. I really wanted people that reflect the folks we serve, that connect to them, that are trusted by them, that walk the walk and have integrity. And so this is the team that we've built. A little bit about how the program works is there's kind of 3 prongs to the program. There's food, education, and patient monitoring and support. Are those the 3 buckets of the program? It's a year-long program. People get fruit and vegetables, a $50 amount every other week for a month or for 12 months, so 26 distributions of food. Then we have cooking, nutrition, and stress management, lifestyle change classes. We do a very holistic approach to education, and I really think food is kind of a teaching tool. Education is probably the most important thing, but the food certainly gets people to come. And we do require that people attend 2 classes per month, and we run a hybrid version, which this comes into telehealth. Um, we run a hybrid version so people can come in person, they come to a class, then they go and they are able to pick out their food, about 2 grocery bags worth. And or they can also do this completely remote. So they can get delivery and they can do virtual classes, and we record those classes on our YouTube channel. So if you're interested in seeing those, you can go to our YouTube channel, FreshRx Oklahoma. So these are kind of the 3 buckets. And then every quarter, we're measuring outcomes. So we're measuring A1C, weight, and blood pressure. We'll probably end up measuring more things as we kind of expand to other metabolic disease. Chronic heart failure will be something we'll be working on. So we measure blood pressure, and we get a baseline metric, and then they're in the program every other week. And then every 3 months, we measure these outcomes. This is kind of how it works. I have 2 little visuals on this. We get a clinic referral from usually a primary care physician. They send that to our system. We do an enrollment process. We provide a starter kit for them. We have a team that supports them, and we track their patient engagement and have reporting and outcomes that we report on. This is a little bit more about kind of the process that the patient goes through. There's a referral, like I said. We screen them for readiness for change because not everybody is ready to be committed in this program. We have a orientation. We provide a starter kit with cooking utensils, a cookbook, 2 reusable bags. We provide them other resources, social services resources, a place to store their recipes that they also get when they pick up or receive delivery from their food. They get correlating recipes as well to help them. They get that. We get their baseline health data. We measure that quarterly. 12 months of education and food. We track quarterly metrics, and then they graduate after a year-long program. They're also reassessed at that time for re-enrollment. We've had people had continued success in deepening their work on themselves in multiple years. So, for example, the first year someone went from an 11 A1C to a 9. The second year they went from a 9 to a 6.6. So we've seen this in other states like North Carolina as well, where they've had continued success and continued savings on people long term. So what were the outcomes of these programs? Pretty awesome outcomes. These are from our first 3 years here. We've served about a little under 500 patients now, but this is our first 3 years, 311 patients. We served 27 small-scale farmers. Our largest weight loss was 116 pounds last year. Our largest A1C reduction was 13.6 to a 5.4 in 6 months. That's fully reversing type 2 diabetes. Our average reduction has gone between kind of a 1.9 and a 2.2. So pretty good. That was our goal, 1 to 2 points in a year. Because of how much money we've spent on local food, we've stimulated a lot of local economic impact. 1.5 million we've probably spent about $500,000 on local food. We've built a local food system on the back of this program. And we've estimated, and I would say now, currently, about $5 million in healthcare cost savings for the state of Oklahoma. And this is Miss Jo Lynn. She was that woman who lost 116 pounds. She's actually now lost 132 pounds. She's fully reversed her diabetes in 8 months. She had diabetes for a decade. When she was told to manage her diabetes, we told her she could reverse it. She fully reversed her type 2 diabetes in 8 months, and she came off all of her prescription drugs. And you can see she's a pretty happy lady now. She said she was almost on her deathbed before she got referred to us. We see many stories about this. Not 132-pound weight loss, but we've seen 50, 70, 90 pounds. People feeling like they have energy again, super hopeful, can keep up with their grandkids. We've had people who had partial blindness because of that diabetes be reversed. People had floaters in their eyes that went away. People who had cancer that went into remission. The list goes on and on. And we've done some policy work. As Haley mentioned, I co-lead the Food as Medicine Policy Coalition of Oklahoma. The state of Oklahoma was, of course, asking us, when are we going to see if we do this? What's our return on investment? When are we going to get this money back? And a lot of healthcare entities, they think, oh, that's going to take, 10 years to see some of these outcomes and cost savings. And it's, as you can see, it's not true. We're preventing ER visits. They're reducing their dependency on prescription drugs in a matter of months. We're reaping those benefits. The state's reaping those benefits. The feds are reaping those benefits. Our communities are reaping those benefits. And we had a cost benefit analysis done by an actuary firm because I was trying to prove a point to the state. And this was really great. The state worked with us really well on this. We got actual claims data from State Medicaid of Oklahoma. They said if we had a 5% penetration on all those with type 2 diabetes on state Medicaid in Oklahoma, which there's 118,000 people with type 2 on state Medicaid in Oklahoma. A 5% penetration would be 5,900 people. And the actuary firm used a lot more conservative methodology than I agreed with, but that's fine. They should be more conservative than I am. They said we could save the state up to $28.5 million net on just 5% penetration on these folks. So huge benefits, policy-wise, healthcare-wise, which just has this huge ripple effect. And I really believe after doing this work that these farmers are truly healthcare providers in a way. And I like to call them the pharmacists with an F. They're they're growing food for nutrition. They're growing food that doesn't cause inflammatory response because they're not using herbicides, pesticides, insecticides. And they're truly incredible people that are very under represented, under empowered, and I really want to see them get paid for driving these healthcare cost savings down. This is a picture of our farmers. I turned over stones. We don't have a food hub in Tulsa, and I really curated this group of folks. We do farm visits. We help them get access to other markets. We help them get grants. We help them get high tunnels from the NRCS. We treat them as important as the patients themselves because in order to continue to have integrity and create community and drive these outcomes, they are key to this. I've done a lot of support to them pro bono as funders don't want to fund a farm or certain agricultural things. They want to fund healthcare outcomes. And some funders have truly recognized, I'm really proud to say, three of our biggest funders this year deeply recognize this value and are very aligned with it. And it has been an absolute joy. They've increased the production of food. They've diversified crops available that were culturally appropriate. So many of our participants wanted collard greens. No one was growing collard greens. So we worked with the growers and commissioned them to grow collard greens. And now we have more collard greens than we know what to do with. And then on May 1st, we passed the Food as Medicine Act of Oklahoma. There's 20 something states that have passed legislation like this and serve people on Medicaid through what's called an 1115 waiver or in lieu of services through managed care. Governor Stitt did sign this. They had a ceremonious signing with Bobby Kennedy at the Capitol about a month ago. And I am working very lockstep with Healthcare Authority of Oklahoma to help them pursue these federal pathways. So it really directs the Healthcare Authority to do that. We have a rural pilot coming up. We're expanding in Tulsa, and we're working with our managed care organizations to go ahead and start contracting. And something that is really important is we have kind of set the precedent that we want to do a value-based care contract, that we really want to have bonus payments, a price per month per patient, bonus payments based on these outcomes to keep everyone accountable, and so that money flows back also as dividends back to the farmers based on these outcomes. So we have an arrangement with a current insurance payer who's it's a dual eligible Medicare Medicaid plan. We're hoping to start executing contracts with Medicaid and other Medicare entities. And there are programs all over the nation doing this, many of which are still on grant funds, but some who are braiding funding and billing. Massachusetts and California were some of the first, but Kentucky, Florida, Illinois, Alaska, Hawaii, New York, many states are doing this work. And so it is a big shift and a big opportunity. I just met with CMS when I was in DC, and they're very excited. They're all trying to get aligned. I think there's some question about should healthcare fund food? And so we're really educating people on why they should. So I just want to leave you with this. And so we have a little bit of time for questions. When we heal our soil, we heal ourselves, and we can truly change everything. And FreshRx is a testament to that and how it's created community and connection between farmers, healthcare providers, and patients, and all those working across the sectors to make this happen. So thank you all so much for listening. This is a food as medicine resource guide that I developed on my website, erinwmartin.com. If you're interested in potentially starting a program or just interested in learning more about policy, there's a lot of resources if you want to get down in the weeds, lots of free resources, how programs are structured, where they are across the nation, how policy has been shaping this, what are the federal and Medicare and Medicaid pathways that can do this. And I do think that telehealth is a huge component to how we can administer some of this education, tracking, and reach more people in rural areas. So I'm very excited to hear your thoughts. And we are going to mention an event coming up, and then I will shut up. Advancing Food as Medicine. There will be the leading nutrient density information at this conference in Edmond, Oklahoma on October 21st and 22nd. And I will put a link in the chat for this. And I see a question already, so I will get to that. I want to put a link in this chat really quick. We'd love to see you at this conference.
And we'll include that link as well, too. So everyone in
yes,
the
Haley
follow-up
will
email
send
will
it
make sure
out.
it's in.
Great. And I love the question, how involved are dietitians? Do they do consults? Dietitians are very much involved in these types of programs. They're very involved in medically tailored meals. So there's three kind of buckets of these programs. There's produce prescription, which is just fruits and vegetables. There's medically tailored grocery, which would include like meat and dairy. Not as many people in that sector. And then there's medically tailored meals, which are pre-made meals. There is a group called the Food as Medicine Coalition, which really represents medically tailored meal nonprofits across the nation. They have a standard of care and standard of quality for these meals, and dietitians are very much involved with that process. We had nutritionists and dietitians kind of look over what we provide, but it's all fruits and vegetables, and we don't have anything that would disrupt medication, because none of those items are actually local anyway, and so we wouldn't source them, like grapefruit, for example. We do have some of those folks that teach classes and answer questions, and we encourage our participants to meet with nutritionists. We actually have a diabetic educator, registered nurse, who and a nutrition educator who's our we have a nutrition educator who's our director of education, and then our program director is the diabetic education and registered nurse as well. So we have medical professionals involved. And a lot of registered nurses actually run these programs because they can do the health testing, and they have a lot they can offer to these programs. So great question. Can you share impacts you've seen with children and whole families? Yes, great question. We support a childhood obesity program. We have people love the quality of food and the sourcing we do, and so we've been contracted to supply food to some other programs, and they'll do their own education and enrollment. It's very key. Um, if you're gonna do stuff with kiddos, you've got to educate the family. They're obviously doing the purchasing. So in this program, they teach the kids, they have a three-prong education for the kids. They do cooking, nutrition, and then how to grow your own food. So these kiddos get to learn how to grow their own food. And they go and they get to share it with other families. And they do require mom to come to so many of those classes with the kiddos, and they send the kids home with stuff. So I don't know the outcomes of that specific program quite yet. It's kind of early on, but they're measuring BMI and the reduction of BMI in kiddos. Um, there's definitely a huge need for this. Lots of conversations on improving school meals, and having local food go to schools. Very important stuff. A lot of stuff there's some great programs with maternal health with food as medicine. It is reducing preterm labor. It's increasing birth weight. And the cost savings from that, can you imagine? Obviously, just incredibly important in general, but very exciting. They're starting to really use it in cancer too. Not so much as saying it's a treatment necessarily, but that it helps with response to their treatments better and survivability. So lots of different sectors working on this stuff.
Thank you so much, Erin, for both of those. I'm going to see any other questions that anyone has for Erin. You feel free to type those in the chat, or if it's easier to come off mute, we can go that way as well. And I'll just ask a quick one too while we wait for some other questions to come in. You mentioned that some of the education, that's virtual as well and on your YouTube. With those patients that participate virtually, do they go home with any kind of like wearable devices or remote patient monitoring, or are they coming in person to kind of get those vitals checked and tracking for that data?
Yeah, they either have to go see their doctor and get us that data, or they do have to come in person just for those health checkpoints. I would love, and I have been exploring a little bit of working with more of those chronic disease management programs where they have those remote patient monitoring, and I do think that there's an opportunity there. And there's a lot more data, and I think the health insurance would love that. So I do think it's an opportunity there. With lots of partners we've looked at, we do have the ability to basically ship the food anywhere in the state, and there's other partners in other states, of course. Um, and so, yeah, I think it's a great opportunity there. I'd love to hear more people's ideas or if they've seen this in telehealth programs. I'm sure there's some nutrition education. We do like live cooking demos on the Zooms. We've actually had to teach people how to use Zoom. We had very low attendance initially on virtual classes. So it's really nice if you can get people cooking with you. Um, so yeah, I'd love to hear if there's, things going on already that you think are similar or parts of this. Um, I think it's a great idea.
Yeah, definitely. And, always good to have ways to expand too. So I think that,
Yep.
maybe wearable devices could be a way to measure that for those that aren't able to come in person later.
Absolutely.
Yeah, any other questions anyone has for Erin on FreshRx, maybe the upcoming conference or anything she covered in the beginning? And as always, if you have any questions that come up afterwards, you can always email them to us at htrc@kumc.edu. We can, prior to letting you go and give you guys a little bit more time to think of some questions, we can go over some upcoming events that we have with HTRC. So we will get that slide pulled up. All right, so coming up on August 26th, we are doing a co-hosted webinar with the Texla TRC. That one is also going to be focusing on nutrition. So we'll be bringing in a licensed professional counselor, Dr. Logan Winkleman, as well as a registered dietitian, Megan Olalde out of KU, and they'll be talking about their roles and how they advance nutrition within those roles. And then on August 27th, we will have Rochelle Marding. She'll come and discuss the new proposed physician fee schedule. Both of those will again be on Zoom at noon on the 26th and the 27th. So we definitely look forward to seeing you guys there. I do just want to give another round of applause and thank you so much, Erin, for coming today. And really congratulations too on your work in getting the Food is Medicine Act passed in Oklahoma. I know our team, we were recently just looking too, and we found out there is a Kansas City or a KC FreshRx as well, kind of doing similar work. So it's exciting to see that over here in Kansas as well. But just want to thank you so much for your time today. And just thank you so much to everybody for joining us, and we'll see you next time.
Thank you so much, Haley, and everyone. Thank you.